Health Tech Hub, Jesper, my partner, you saw at the registration there, Roween, Annette, my colleagues, please talk to them. They're very nice. They know the best words as well. You're going to enjoy spending a little bit of time with them afterwards. As things, starting with what's on a few practicalities, what's on the panel right now. We're going to have a panel debate on the second part of the meeting, and you can submit questions to the panel using the Slido link. You can use the phone, connect to it, and submit questions and upvote the questions that you would like to for the panel to answer. Aside from this, please, if not now, after you leave here, download the Corona Tracing app. It's important that we keep responsibility and we stay at the somewhat luxurious position that we are in now compared to the rest of the world. Now, that said, we're now at a time where we have a little bit, things have settled slightly, and we have a little bit of time for reflection. And we'd like to share some of them. We're very, very excited to have a very diverse panel here that will share perspectives from every part of the ecosystem. We unfortunately are missing Henning coming with the patient perspective because he had some emergency health issues, but he did send us a video that we are very eager to share with you afterwards. A couple of reflections from our side, and we can probably talk for a week and a half about everything that we learned and everything that we experienced in the past few months. But I will just use 3 minutes and 3 headlines. First, reflections from the patients. Patients value using technology. They're comfortable with it, even when they're thrown into it without much preparation. The Association of Danish Patients made an interesting study that I think we should take with us. And all I can say about this is quote one of the directors of one of the largest patient associations here, who said, "Patients have been waiting for this for a very long time." This is something that we mustn't forget. Second point, privacy. The privacy discussion is a little bit more complex than we thought would be. This is something that we never thought we would read before coronavirus. France was one of the governments that publicly asked for Apple and Google to lower their privacy standards. There are at least a dozen other countries that did so less publicly. This is something to keep in mind. And the second lesson and the second reflection we have around this point is that discussions are important, but action always trumps discussions, and the discussion around privacy becomes secondary when we need to act fast. And the third point, collaboration works, regardless of whether you're a large institution or a government or a country. No single entity can advance health and bring the same value to society as we can do through collaboration. And whether we're talking about research, finding a new vaccine, or we're talking about releasing a new app, or about protective equipment, we need to collaborate more and more. And aside from this, we need to collaborate with the individuals, because regardless, no matter how many apps and how many lockdowns we set in place, the only sustainable way to address and maintain what we have started is through individual responsibility. So the individual is important, and we need to keep this in mind. Now, nobody signed up here to see the opening act. I'm very eager to hear the interesting presenters that we're going to have today, who are also going to share their perspectives. And on the second part, we are going to look in the future and see what do we need to do to keep the momentum of what we started, and what can we do to take the lessons and reflections that we're going to hear now and put them to good use for the future. With that said, I would like to invite the first speaker, which is, I'm looking at Annette. It's not Annette, but is...
If you click one more.
Yes.
Thank you.
Nanna. And we have a microphone so that we keep the hygiene measures in place.
Thank you. Good thing. Good morning. My name is Nanna Skovgaard. I'm head of digital efforts within the Ministry of Health. And I'm going to share with you some of the reflections I've had on COVID-19, both on what we did and what we've learned. But first, some rules of the game here. I thought, in accordance with Mette Lindstrøm from the Danish regions, I would like both to say thank you to Jesper and to Valentin and you all for putting up this event and access to evaluate on what did we learn, what happened, and how are we going to move forward, so that today we could have an open discussion on this and put forth your impressions, and we will share our impressions with you, but that we have it in the context of this being a room to have a free and open discussion. So it's it's not necessarily the Ministry of Health, would you say, official position on this or that, but it's an open discussion. I think that's fruitful for all of us. So that would be the first point. Thank you for taking your time. Second point would be, I don't know, you remember what happened when Corona struck Denmark, struck the world. And for me, it was I was actually going on a trip with you guys from the hub, because we were going to South by South in Texas, Houston. And I was this COVID-19 has got nothing to do with me, because it's something about an epidemic, and I'm going to the US, and it's probably not going to hit there. It's probably not, because I want to go to the States and I want to be with these guys and talk about technology. So I haven't got the time for the epidemic. And of course, that's not how it works. And eventually we were all stuck by this epidemic and everything that happened, and how our lives changed for the last month. But it's just, it was you. I started it out with you, and I just I think that's interesting. And it's also interesting then that when Jesper and Valentin started making papers, and I guess with inputs from many of you people, it was we knew who Jesper was, and that I think that made a difference for us in taking the advice from you and from new Danish tech companies. So we appreciate that. Thank you. Okay. Let's do the slide thing. Yeah. Digital efforts to combat COVID-19. I thought this week I'm going to stay here, to come here today, and you will tell me all the things that we did wrong within the ministry. So I thought, maybe I should just, mention, we did do something happened, and then you can tell us, all the bad things. So this is the list of groceries, or the list of things that actually did happen and that we did prioritize, and I think from my perspective, when it dawned on me that this epidemic has got something to do with digital efforts, and we can look at it from a digital perspective. It's not only about keeping your distance and hygienes and sanitary tools. It's also very much about, well, putting digital efforts into place. The first thing that came to our minds was the whole thing of using video and to use technology to support social distancing, basically. And we had for a while, we've been working on video consultations within our general practice and video consultations within hospital care, psychiatric care. So we put a lot of effort. We got out some money. That's always how it happened. We asked the government, can you quickly fix a budget for us to make investments into our national video infrastructure, because this is what we need to make this happen. And within, well, a few weeks, we had set up a new video tool for our general practitioners and for our physicians and for psychiatrists and hvad siger man, psykologer? What would they be? Psychologists, of course. Well, to do more video conferencing, and the idea was, if you have an epidemic, there are people who we want to keep social distancing, and there are people who are especially vulnerable, and can we help them to stay at home? I remember that from Turkey, there was this story that people, they had to stay at home, except when they had to leave their home to go to their doctor. And I thought, okay, this is exactly what we don't want to happen. People who are vulnerable we should make it possible for them to stay in isolation. So that would be like first thing to do, first effort. The next thing was this working what we call the patient-reported outcomes. That is questionnaires so that you can keep people at home. You don't have to go to the hospital unless it's absolutely necessary. And the idea again was both for people with COVID-19 and for people with other diseases, could we make it easier to give treatment for them at home? And hence making what you said, so that we wouldn't mix up the polluted water, the polluted patients with the clean patients, and really try to keep them separated. And for the inspiration for that idea was not least from Tia Fischer, who Jesper and Valentin brought to our attention, and an epidemic from our northern hospital in Zealand. So we had some conceptualization as to what's the proper way to treat both COVID-19 patients from a hospital perspective, from a treatment at home perspective, and how can we keep them in one trace and other patients in another. And we had some discussions both with the Danish regions and with the group of people who prioritize efforts, digital efforts within the regions, to make sure that this was what we prioritized. What we also learned was that if it was new technology, new vendors, new ways of working, we were not able to put these technologies in place because we had weeks and everybody was stretched, you'd say. Okay, no, one back, and thank you. Second thing, of course, looking for safe patient pathways. Once you have a COVID-19 patient, you absolutely do not want that patient to pollute other patients. So to put a digital tag saying this is a patient with COVID-19, and we had to make absolutely sure that for all patients in all our 100 municipalities, all general practitioners, that we would know for sure that if they had a patient with COVID-19, that they would know this. So we used the Medcom, the infrastructure we have for sharing information across sectors. We just made like a tag into that system saying, a red mark saying this is a COVID-19 patient. And the beauty of it was that we could do it like from one day to the other because we had these systems in place. Thirdly, I need some water. Sorry. Annette, you have to go one back. Sorry. Thirdly, we put up what we say fast and universal access to testing, and of course, testing is about the proper equipment and the labs, but it's also very much about digital support for the testing capacity. What we've done is we took a Danish the system we have in place in Denmark for making referrals that has been in place for 10 years. It's a Danish vendor who provides it, and we said, you use this system for ordinary referrals. Can we please take your system and put up referrals for all Danes so that they can just go and get tested whenever and wherever they want to be tested. And they were like, no, we cannot. And we said, oh, please, can you look into this? And then they returned and said, well, okay, maybe we can. We can set up a booking site, a national booking platform, so that all Danes, whenever, where they live, wherever it suits them, they can just book a time and they can get a referral. So we don't want to have queues outside in the testing facilities. So you need a referral, you can book your time, and you can get your testing results within 13 hours at Health DK. And to have that as it's a universal system, it's national rolled out, and we did it, I think, Mette, within a month or so, with the help of technology and vendors we knew, and people who knew something about this and put up their, shared their competences. So testing, universal testing is important. Tracing, contact tracing and exposure notification. We have a setup for manual contact tracing, of course, and we've just launched this app Smittestop to trace unknown contacts. That was also a priority, and it was a priority very early on in the system that we wanted to work with tracking. And I called Jesper and I said, I get all these calls from Danish companies and foreign companies, and they want to work with exposure notification and contact tracing. And Jesper, he said, well, but for now, we don't think the technology is good enough, and the recommendation from the authorities is keep your distance. So be careful what you communicate, and be careful how you enter this field. But eventually, it was like, okay, we need a contact tracing app, and then we started working on that. And then, of course, I thought a point to make is, of course, if you work with this, you need trustworthy data. From a government perspective, from all hospitals' perspective, it's been very important that you had up to date data on how many people do we have with COVID-19, how are we testing, how are we doing. So from a government perspective, they work with dashboards almost from day one that could show what is our capacities, where do we have lacks, what do we need to do. And those data is also it's in our MIBA system. That's our microbiological database. So it's also it's a system we've had in place for years, but that we have ameliorated to support the COVID-19 effort. And then I just wanted to, it's just a small note. You know Euromomo? It's a website that shows mortality rates for 24 countries. So it's an international website. It's been put in place by the Serum Institute, and like before the COVID-19 crisis, it looked like something from the 90s. It was like the ugliest homepage like you've seen in ages, and nobody had ever done something with anything to modernize it. But the data was brilliant data, and Kåre Mølbak, he called one day and he said, we need to do something with this homepage because it's crashing down, and everybody wants to see it, look at the data, and but it's like it's so old-fashioned. And then we got in contact with the New York Times, who had their graphic data, editor, and he was a Dane. And he said, I'm going to fix this for you. So like within a week, he had put up this web page, and it's visited, I think, from media and people, decision makers, researchers from all over the world. I think they have like 1.5 million visitors when new figures are coming up. So it's just to say we've done something digitally for Denmark, but we've also tried to bring something back to the world. Finally, something on hospital care and what we've done there. I think maybe you'll talk some more on like the very advanced technology when it comes to robots and AI and advanced technology. Annette, give me the last one. I'll try to be as fast as I can. So what did we learn? First thing would be like, of course, we are always, when we work with digitalization, we're always looking for a burning platform. Well, guys, we got one. COVID-19, that was like, if ever there was a burning platform, that's the one. So if there is one, and this was the discussion we had very early on with Mette and the people from the Danish regions and also with the local municipalities, we want to use the COVID-19 as a burning platform to do things that we already know that we want to work with. So we want to strengthen and reinforcing existing priorities, using channels that we know, competences and context that we know. So we cannot do something all new in the midst of a crisis, but we can take the efforts that we have in place and try to reinforce them and accelerate them, like we did with the video. We're also looking for inspiration and new ways of doing things, not least working with digital tools in terms of tracking. But like Valentin mentioned, it was very evident that there's a red line when it comes to privacy rules, when it comes to what is a democracy, how do we want to have a society with each other. That when we hit the crisis, it's very important to, well, okay, we want privacy, we want our liberties, we want to take care of each other, we don't want the police to tell us where we are because we can do it ourselves. So I think the crisis is very much about reinforcing the core values of our societies, and when we work with development we have to really pay attention to that, because use the crisis to make an even better society, not to lose that. And then new decision structures and tools. We've all tried to work now with video conferences. I've made projects like the app. I've made it with people. I've never met them in real life. We did it in 2 months. I've only had contact with them on video screens. But what one realizes is you use these new tools, but you also have to have your old virtues in place. Like, so how do we structure? Who makes the decisions? Have you got everyone on board? How do you communicate? If people don't know what is the idea and they don't feel they're in the loop, nothing happens, like in everyday life. So this also goes when you have a crisis. Really pay attention to your decision structures and your leadership. Yeah, and finally, it's like your point, Valentin. I personally have this feeling of, well, clear sense of common purpose and shared burdens, and it has been a team effort, and it will continue to be a team effort to get us through this crisis and use it to invent new ways of having, well, healthcare system and societies with each other, using new technology. Yeah, so the discussion today would be then what should be the next important steps. Nu er det kollega med den sidste, Annette. Annette? Would you give me? Yeah, so where do we go from here? That would be like final slide. Thank you. Oh, Valentin, I keep the microphone? Yeah.
Thank you. So we already disrupted the time schedule, Annette and Valentin. So I'll try to be short. And thank you for inviting us. And the same disclaimer, we are still in lesson learned, and so can we have an open dialogue about that? I live just 2 blocks down in Danish regions. We're the interest organization of all the 5 regions in Denmark, mainly running the hospitals, but we're also doing other things. And I will say it's actually very interesting now to think about the reflection. Where were we when this happened? What did we actually do? And we had a lot of conversation, a lot of things going on, a lot of inspiration coming from you, coming from Jesper. You organized it, you gave us reports, you gave us an outview. So thank you very much for that. It has been really, really helpful during this crisis, but actually also when we're looking at the other side. So I think you all have seen quotes like this. And actually I would say what was very important for us was, it was not so much things that we didn't think we could do before, but it was maybe things that we were only dreaming of doing. That was actually happening. We have been dreamed about having video consultation all over Denmark for general practitioners at hospitals for quite many years. So we already had some things in our pockets, some paths laid out, and suddenly we could put emphasis on that. That was what was happening in the COVID crisis for us. And actually one thing that was a guiding principle for us, that was we have to look at the other side. We have to think about what we introduce, because there will be a day after the crisis where we have to get back in running the business. And we all know that rolling back is very difficult. Introducing new things that are not safe, not proven, not tested, it's very difficult for us. So all the time when these things were going on, we already had the perspective on what is going to be on the other side, just as a guiding principle. So I will run through some of examples, and please stop me, because I guess as Nanna we have all been very enthusiastic about this time, and it has been really, really exciting. But I would like to run through some examples of what we did, but also give you a view of what is it we are looking into now, even though that we are still in the crisis. One of the guiding principles was that we had to extend what we already knew, and we had to extend what we already did. And that was one of the main principles we were actually leading as. And Nanna already gave the example of we had some booking sites already, could we extend that? We had to support the test facilities from getting into the test, having your test results in your pocket at an app. We had things already that we could enlarge, and that was quite important for us because we want these things to happen after the crisis also. When said that, we also did a lot of new things. We could do things on the surface of what was already behind. For example, we had the chatbot from Microsoft that was developed in the capital region here, and within a week it was all over Denmark. So things like that happened because we were extending our organization, our systems, our economy, our risk-taking, and our relations. And I think that it's really important that the relation we already had, we could extend it. So things were actually happening. As Nanna said, we broke down the normal hierarchy of how we are making decisions. And that's one of the things that we would like to look into when we are at the other side. So, of course, this is not the whole truth, but just to give you an impression of what was important for us. It was very important for us that the thing that we were introducing was something that we could click in to the building blocks that we already have, and something that could actually help us do things on the other side in a better way. The next. Just to give you an impression of, maybe some of you would ask, why didn't you just take this device, or why didn't you just introduce this? Just to give you the impression of what is the daily business in our life. Our daily business is that we run hospitals 24/7, of course. They have to be safe. They have to be secure. That's number one. We have 3,500 general practitioners in Denmark. They are located on 2,000 different places in Denmark. They do 42 million consultations every year. We have almost 50 hospital units. 21 of them are acute hospitals, so very big hospitals, and they have clusters, communities around them. And that has been a very guiding structure that we could actually use in this crisis, because the relations, the organizations that were around those clusters were actually working much more efficiently in this area. So that is one of the things that we would like to take with us on the other side, that these clusters and this collaboration between municipalities, GPs, the hospital and the private sector has been really, really fruitful. And I think the private sector's role in this crisis has been very obvious for everybody, what actually happened and how we could use each other. Getting the right supplies, getting it distributed all over. We couldn't do that alone as a public sector. And it has been really, really helpful with the close integration we had together. So just to tell you, why don't you just go and implement what we have all over Denmark? This is because it's a really, really big super tanker that we are running, has to be really safe, has to be really secure. And of course we can introduce new things. We can have small speedboats, and we had a lot of them. But we have always to find the right balance between those things. Yes. So just some of the numbers. If you take the next one, Nanna already mentioned, video consultation was one of the great things, and we are now collecting the results. We're trying to find evidence of where is this really important and where can we use it. And we actually have some quite interesting results already. For example, within psychiatry, some of them say we have less no-shows when we do video consultation with some patients than we had before. Maybe quite obvious. Some of them don't want to be looked at as patients. And so there are actually places where this is added value, where this is good service, where this is convenient for us, and maybe it's also better for the healthcare system. There also might be places where we are overlooking something if we do video consultations. So we have to dive deeper into the evidence. And a lot of research and also evidence-based, try to find out what are the best going on right now. We can't say that it will be too early. I already gave you the example of the chatbot. Nanna showed you a lot of other examples of especially these things where we could put it on the surface of what we already had. That was the most successful in getting things through quite quickly. Yes, so what is next? When we were working very efficiently in the COVID area, we at the same time had a long journey putting up a new strategy for the region's collaboration with each other on digitalization and new technology. And actually, as I said before, things that we were only dreaming of were happening. So we had already put a path forward in this strategy that we could actually see it can happen. It's not launched yet, so please don't post it on Facebook or LinkedIn now. It will be launched in the weekend, we hope. And there we have made some of the ambitious goals that we have moving forward in the close collaboration we have with the municipalities, with the state, with the regions, and with the private sector. So just a little teaser for you here. And then you also often ask us, what are your problems? What can we help you with? What are the bigger problems you're looking into? We always have a lot of problems in the healthcare sector. The hard thing is to find what are the most important ones that we're going to look at first. So just to give you a list, that's the last slide, on the political to-dos that we are looking into in the coming years. These are some of the things that we are really curious about how we're going to solve that. Of course, healthcare close to you. We have seen that with the COVID. How can you stay at home? How can you get the service in your home? That's really in your own life, not getting into the hospital all the time. Psychiatry, we need a big lift in the psychiatry area. Prevention and inequality, always a big theme. Climate changes, of course, how can we use digitalization and new technology within the climate changes? We have to look into that. Recruitment and doctors' availability all over the country, also in the difficult rural areas where it's not so attractive to be a doctor. The social care, and of course, efficiency and prioritization. We had just, maybe you saw in the news, we have launched a new council. It's a little bit like the medical council we have just on the other side of the road here. But this council is concerning new technology. How are we going to introduce and implement new technology within the healthcare sector? It will be located in the north region. And they are now putting up the organization for looking into how we're going to introduce all new technologies in the healthcare sector. So these are some of the political to-dos, ambitions, focus areas that will be concerning us in the year after COVID, or at the same time as dealing with the second wave. We don't know. So thank you very much.
Hi. Good morning. Okay. I'm Helle Pappert. I'm a professor at the University of Copenhagen in patient involvement and patient-reported outcome. And that's probably why I was invited today, because I feel that that's very much what this is about. I'm also a storyteller, so I'm going to share some stories with you. First of all, I want to thank all of you for the unique development of new technologies within healthcare, which I'm sure will help patients to have better life in the future. I also want to thank Nanna and Mette, who just showed how the Danish society is able to move forward when it's needed. But I don't know what you're thinking about when you're hearing these tellings. I think about a castle 45 kilometers north of here in Elsinore. There, Kronborg Castle is situated, and in the basement of that, Holger Danske is sleeping. If you went there, you've seen him. There's a big statue. The story is that he is sleeping and waiting for Denmark to get in need of his help. And if Denmark will experience crisis, then he'll wake up and fight for the Danes. And it seems as if he woke up recently and helped the healthcare system to move when it comes to e-health solutions. And that's really nice to hear. And I hope he'll stay awake. And actually, I hope he'll fight not only for the Danes, but for patients and healthcare systems throughout the world. But maybe he woke up a little late. So I want to share with you a personal story. When the pandemic started, my family unluckily were hit by this. My daughter, she fell ill with corona, and that was very early. That was in the beginning of March, even before the lockdown. And she was diagnosed with the virus and of course had to stay in isolation. And we spent every meal during 2 weeks talking with her on FaceTime. I left all her food by the door, and she spent all the time alone in her room with her private bathroom. During this period, the first thing she was met by was a piece of paper from the hospital stating some symptoms you can experience when you are infected by the virus. But that was the only information she got from the healthcare system. And you know, at that time, by hour nearly, the recommendations changed, but there was no information given to patients on where to find information at that time. I know it got much better during the period. Unluckily, she was also taken into hospital, and she was isolated there in Department of Epidemics. She was left by her alone, 21 years old, only met by a healthcare professional once every 8 hours. And while she was there, we were still on FaceTime, and we were starting, she's a medical student, her and I were starting reflecting on all the nice things which are available in the world and would have been wonderful to have when you are in this situation. Not only for her, but for every patient in the world hit by this. And we started to read all the international newspapers, all the research papers where more and more information was published about the potential of e-health in a situation like this. And, you know, with this personal story, I just want to say to you that the patient's perspective on what we're doing and the patient's expectations can be different to what the hospital owners or the ministry or whatever thinks about this. So, and I think a very important issue that is that we move in the same direction, that we create solutions which make sense not only to the administrational layer or to the researchers like myself, but also to the patients. Please show the slide. So what my daughter and one of my research students and I myself did was that we tried to sum up the literature on this, and we got in contact with Valentin, and we saw the very nice initiative taken to kind of make a list of what is out there and what can possibly be put into use when we want to struggle and fight with an infection or pandemic like the COVID-19. And in this paper, which is published in Telemedicine and eHealth, we are trying to communicate how important it is to take into account also the patient's perspective. And that's not only when it comes to telemedicine and COVID-19, that's always. And if we want to have success with telehealth, not only in Denmark, but in the world, it's of urgent need that we take the patient's perspective into account. You can see that when you look at the Norwegian experience with the COVID-19 app, and in some way disappointing use of the app. I'm sure if you'd asked the patients up front what they wanted from the app, of course no one wants to get ill. That's probably a common wish, but patients may have other wishes which can endorse them to use these technologies. And if we don't ask the patients and get to know what's in the new technologies for them, then we will have no adherence to the technologies, and the use will decline before the technologies are implemented. So I just want to finish this by saying, please, whoever you are, a health care service worker, an employee at the state, a developer of new technology, an excellent engineer, please, 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 don't forget the patient perspective. Thank you.
Yeah, hi everyone. I'll try to make this short so we can come to the interesting part of the panel discussion. I come from one of these companies that provide digital solutions. Very specific, we have actually been working within this space that everyone is talking about since 2015, which is improving hand hygiene. So everyone is talking about hand hygiene today, but we have done this for a long time. And I really hope that this conversation will also continue when the daily lives struck again. We can all go to our holiday places around the world, that we still think that hand hygiene is important. And the reason why is because COVID-19 seems like a really big impact on our lives. But MRSA, multi-resistant bacteria, they will be a much bigger threat in the future. So just to take into perspective, there are 700,000 people dying from it today, much more than COVID-19. So hand hygiene is not just important because of COVID-19, but it's important for everyone in the future. And that's what we're working with, and we really hope that the energy that the public sector have in implementing solutions that are also preventive will continue also the next years in the future. Yeah.
I'm Pernille Schmidt from Roche Diagnostics, and I would also like to thank you, Health Tech Hub Copenhagen, for taking this very, very important initiative. As I said to Valentin when I came this morning, I'm even relieved to get a little bit out. Roche Diagnostics is a big diagnostics company. We are working both with testing, but also with digital solutions. And to give you a little bit of background, it's actually 1 year ago. It seems far away, but that was when we entered with a partnership together with the Health Tech Hub Copenhagen, because it's very, very important for us to start thinking in an ecosystem thinking. Roche Diagnostics cannot, or Roche cannot develop everything on their own. They want to have that close collaboration with startup companies. That's how we bring innovation. So on the one side, we are heavily involved in development of new tests. And I think that is one of our big learnings on the industry side is if you focus all your energy on one project, on developing one test, you can actually do it within 3 months. And I almost get goosebumps because normally it takes 3 years to develop a new test. So it's amazing how we can put things forward in a quick way if we prioritize and work in a different way. When that's said, then when we look to what have been going on during this crisis, I've also seen a lot of healthcare leaders thanking their organization for that tremendous effort that they have done. It's amazing what have been going on. Often you thank your own organization, right? You thank the healthcare workers, but I think we need a big applause to what we have done together. Because it's not about private or public in a crisis situation. It's about doing it together. And it's amazing to see what happens when you put your hand, and in Danish I would say on the kogeplade. When you do that, all of you, and it's really, really hot, that's where the magic happens. So I can only be very, very proud to be a Dane because we have done an amazing job. Coming back to our interest in digital and the technology side, and digital transformation has been a big strategic focus for quite some years now. And when we talk about digital diagnostics, we talk about the data, the diagnostics data that is already there, how you use that in a better way, in a more efficient way, how you can plan healthcare. But it's also about developing treatment decision support so that we are able to support doctors in a new way. The third and important part in this context is the patient-centered technical solutions. And I want to talk about an example. Because 1 year ago, when we entered with the partnership with the Health Tech Hub Copenhagen, we also entered in a partnership with a site called Nordic Health Lab. Nordic Health Lab is like a co-creation space, innovation space that is created in a partnership with the North Zealand Hospital and the municipality of Hillerød. And then there are also private actors in that one. We did that because we wanted to start the creation of new solutions so that we could talk about prevention or early diagnosis. And that needs to be done around problem statements that is coming directly out of the clinical part. So when we entered the partnership, we started to identify what kind of areas did we want to work in. And we took a disease area approach coming from the patient perspective. And one of the most important ones was to work in the area of cardiac disease. So we started the project and we started combining different solutions from different tech startup companies. Roche is working together with the Criosphere in Munich, and we had access to several startups where we could put together solutions in a whole patient journey. The cardiologists, they were like, I need to see the patient and la la la. But what has happened to that project is that we suddenly moved that forward, right? Because the burning platform was so much bigger. So coming from a project, it was like, okay, we just want to implement now. We just need to implement now. which of course, I mean, we could not do in that way, but it's just all the innovation projects that we are running that are talking into I think it's not only keeping the patients out of a hospital, because it's about generating patient pathways where you don't feel that you are between sectors. I mean, it's about you, it's about the patient, and how we get the best outcomes. So that is really a nice example about the need and how you can also do things in a quicker way when you are in it together, when you have your hand on the kogeplade, then that's where the magic happens. So thank you for inviting me, and I'm looking forward to questions.
Thank you, Pernille. And we're now about to play the video from Henning. I'm very excited about this as well. It's it falls in. I think it falls in perfectly with all the different perspectives that we heard today. There are a few dozen people as well online that are watching us, and we're trying to make sure that they are also seeing him there, and not only us and our pleasant faces watching a monitor.
Hi, my name is Henning Søndergaard. I was supposed to be there with you, but life got in the way in the form of a hospital visit. When I'm not in the hospital, I volunteer for the Danish Kidney Association, and I work as a consultant in the medical field, driving research, innovation, and development in a more patient-friendly direction. I was born with spina bifida. That means I've been in a wheelchair since I was 10 years old. It has now led me to having kidney disease. That means I do dialysis 5 times a week at home after I had kidney failure. When I started dialysis 8 years ago, I had no interest in going to the hospital and doing it, like most people do here in Denmark. I cannot imagine what it must have been like for my fellow kidney patients to do dialysis 3 times a week at the hospital, to leave their home for treatment, having to expose themselves to other vulnerable people almost every other day, not knowing that they might get an infection that particular day. I feel extremely fortunate to be able to do my treatments at home. But it shouldn't be that way. I shouldn't feel fortunate. All kidney patients should be able to do their treatments on the go. But alas, the technology of dialysis hasn't improved since the 1960s. In fact, if consumer electronics had followed the development of dialysis machines, my iPhone would be the size of Tivoli, maybe even including the central station. So why am I saying all this? I'm saying it to illustrate how the pandemic made me blatantly aware that we need to change the way we treat people with chronic kidney disease. We must stop driving people all over the country to get a treatment which they should be able to have in the comfort of their home. It's a waste of precious time for patients, it's a waste of resources for the healthcare system, and it's a waste for the loved ones of the patients who have to either go with them or sit and wait for them for hours and hours. Home therapies have proven over and over again they are much more efficient. Patients feel much better when treating at home because they can get better treatment, it's much more sanitary, and that leads to spending less days in the hospital for complications. Time for innovation in this field is long overdue. The positive side of my experience the past few months is that I've been able to do everything from my home. I could order my food online, my medical supplies were delivered to me once a week. Because I'm in a wheelchair, I have aides to help me a few hours a day with my chores. So basically, I was in my home from early March to the end of May. And I had no need to leave my home or my garden at all. The only people I ever saw were my 3 aides. Of course, I wish they had been able to be tested since I'm so vulnerable as I am. I've had a few doctor's appointments during this time, but they were all done over the phone or via video link. I feel the doctors I've been in contact with have been very accommodating. But I do think the technology could need a boost. For example, the video in the Sundhedsplatform is terrible, and in many ways it doesn't really work on tablets. To sum it up, I think my quarantine has been a good experience. I've learned a lot about my situation and the situation of others who might be in an even worse situation than myself. We've come really far in the last few decades with much more patient involvement and respect for each other. But I think we still have a long way to go, both when it comes to innovation and education of patients, healthcare professionals, and other stakeholders. So let's start collaborating. I don't think we can do this without everybody being involved. Everyone in healthcare, as well as patients and industry, need to work together on all levels if we want to succeed and make things better for me and my patients and my fellow patients. Thank you.
Powerful words from when we listen to the patients. I would like to invite everyone here. We're going to take a few minutes to set up the practicalities, to make sure we're distanced and everybody has a microphone and we can hear each other as well. And we'll dedicate the next half an hour on looking forward, because I think that the one thing that we can all agree is that it can be much more valuable and under our control to decide on what we're going to do next than to look at what did or did not happen so far. First question coming from the hub, with input from a lot of the hub friends as well, is during the past few months we've seen that a lot can happen very fast while maintaining a reasonable level of quality. I think Pernille had a very nice metaphor about the oven. We believe also that the oven was already quite hot. It's just that many of us didn't feel that it was because we didn't have our hands over it. The crisis also brought up some of the underlying pressure points that have been there for quite some time. Good news is that we are also able, and this is an example that we saw around the world, we were able to do a lot in a very short amount of time while maintaining a reasonable level of quality. Now we hopefully have a little bit more time. That doesn't mean that we need to feel all of it and take our time. What can we do to maintain this pandemic speed and for it to become closer to the new normal speed? I'll start with Helle.
Yeah. As I already said, I really admire what we've done under this pressure. And I think to keep up the good mood and the speed, we have to listen to the users. So coming back to the patient's perspectives, what do the users expect from the healthcare system? I think we have to stay focused on that, so that we move away from what we did before. I think Mette said it, that things which beforehand took months to do can now be done in a week. And that's fantastic that people within the administration experience that. And I think we have to listen to the users, feel the pressure from the users of the healthcare system, and use that pressure to keep on moving fast.
Nanna?
I just have the feeling that I've talked enough, so it would be like, can we get more questions and people reflections from the audience? That's my.
Sure. There's we're going to get in 1 minute to Ulrich's question, which is moving from the video consultations to the more remote monitoring as well.
Okay, that's of course we want to do that.
All right. I will go to the next question then, and that is video consultations are working better than expected by many. What are your thoughts on trailing a rollout of digital self-help tools or apps in primary care?
Well, we actually made a COVID-19 patient-reported outcome scheme. And we are in collaboration with the general practitioners. We want to put it into the app, the what we call the My Doctor app. So it's using COVID-19 as the excuse or the direct what you say, like this is the case we can use to make a broader platform that for in coming months we can use it for other questionnaires, for other things to be put out for patients. So we want to work with more patient involvement, more treatment at home, putting more apps into place when it comes to patient treatment. So I think this is one of the things we're going to do in the fall is trying to work with with apps in primary care. More treatment from home. I think that would be one of the main titles that we're going to work with this fall.
And how will the good men and women that have already developed and have been working for the past few years on developing these apps, what should they know? How can they be involved in this? And are you in dialogue with them?
We need more dialogue with the hub and the friends of the hub.
I can't argue with this answer. Mette?
Yeah, maybe to your first question. I think the important part now is to combine what happened in the crisis with running the daily business. And I think actually what the example you came up with from your company is a very good example. We're not doing hygiene, we're not emphasizing that because of COVID. That's just the incident we had now. We're doing it to prevent flus and other things from spreading, and of course to prevent bacteria that we can't treat in normal ways. So I think maybe that's also an advice for you. Can you tell what your product is doing, not just for the situation and the crisis we have now, but for the general problems that we actually want to solve? I think that's one takeaway from now, and so that's what I mean by looking at the other side. What are we going to do there? And of course, one of the things we have learned is that this dialogue is really valuable. That we get disturbances of where do we have to look, what is actually out in the market, what are other countries doing. So keep on that moment. And then I must say, we have also been risk-taking, and there have been an economic situation where things could happen. And of course that is changing. So I think we cannot keep up the same speed. We also have to prioritize very carefully what we are doing. So we will see differences in the rhythm of how things are implemented. One ambition for us in the regions is that we would like to have an open discussion of things that are invented in one place and is working there. We can actually scale that in 1 week, as we saw. And sometimes we have a lot of discussion on that and a lot of analysis being done before we're actually scaling things. We would like to be better on that when it's proving, when the concept is proven in one place, to scale it faster.
Yeah, maybe I can follow up on that. I think Denmark is a really good country for innovation. When I speak with other startups in for instance, the US or even just going to Germany, they have a really hard time getting access to the clinics, to getting access to the clinicians, and testing out their very novel, very untested solutions in a real clinical context. We don't have that challenge in Denmark. It's very easy for us to contact you and say, hi, can I install this in one patient room and see how that goes? And from my experience, you often say, yeah, let's try it out. What harm can it do? And we get immense learnings from that when we innovate and doing this, which means that we can move really fast. And I think from this COVID crisis, there's come a lot of even more openness to new innovations from also the more administrative part of the public sector, and a lot of funding as well, which enables the speed of these innovation technologies to go to market faster. What is still lacking is, of course, as you say, it needs to be proven. We need to look into products that already have proven that they work, and this is just a time factor. You can't put money on that. It just takes time and data to see that it's valid. So that will be the challenge from now on, is to have all of these new COVID technologies to prove that they work, so that the public sector in the future is also confident in actually making it a part of the normal operation.
I felt a few raised eyebrows. There may be some contradicting opinions as well behind me. Helle will follow next, but I would like to go to Ulrich, who is and also Beth. They represent two of the startups that have been around for quite some time.
Okay, yeah, sorry. Yes, I posed this question. I'm going to try to be really brief. First of all, I agree, of course, with Theis that in general there's very good access to testing new technologies, but I don't think that is true in primary care. It's very difficult to get access unless you are part of a research project, or maybe if you have excellent contacts. I wanted to mention this question because I know that some of the doctors that are working with technology have been surprised, even though they're very tech optimistic, about how well-functioning video consultations actually are at scale. And I think that's fantastic, you know? And that just shows to me the importance of trying it out. And I think that's really important that we stick to that, because if we don't try, how will we know? And so that's a criticism that I'm bringing to the table, and I'm also talking to some of your employees at the moment, Mette, and I think that it's so important that implementation and trying it out in practice is a part of what we're doing, so we don't just discuss how it should be, but actually get hands-on experience. And I think also with technology, I mean, Helle, maybe you can comment on that, but I think that actually using the technology is a big part of learning. It's not just having it, it's about using it and developing that tacit knowledge that I think is really crucial if we as a society is going to be first movers in digital healthcare. Thank you.
Yeah, maybe just a comment on that. I really hope that our mindset in the future could be that one test is better than 1,000 opinions. And actually one of the things we have discussed with the general practitioners for a while is that could we have like hubs, some different general practitioners all over the country who are willing to try out things, because we know that some of them are really enthusiastic, where we maybe put some more money, where we also evaluate and get all these first proven projects. We were really like that idea, and we are still keeping up the discussion with them about having small test hubs within the general practitioners. I think still it could be a good idea.
Yes. First, a comment to you. I highly appreciate pilot testing and feasibility test of new technologies within the healthcare environment. And it's good that the hospital's owners have seen how important that is, because if we've tested a lot of technologies before the COVID-19, then we would have been able to move even faster as we did. So I hope we learned from that. And then just coming back to some of the things mentioned prior in this discussion, I also really much hope that we'll stay ambitious. Not only replace the physical meeting with a video consultation, but take the chance to use these new technologies to improve health in the society. So for my cancer patients, I hope that e-health technologies will help improve survival, will improve quality of life, and not only be technologies which replace the care we give today and keep the quality on the level it is. We should use these new technologies to improve quality within healthcare. That's the really beauty of it.
Yeah, I mean, back to the primary care and collaborating and testing innovative solutions. I'm all in for the idea to have it connected to hubs or even own hubs, because that's really needed. That's a clear learning that there are some general practitioners that are really interested to be a part of it, but of course to how they are reimbursed, it's not that easy today. So that need to be cracked in a good way. It's so much linked to the priority from Danish regions on building the coherent healthcare system, where I think all the learnings that we have from the COVID situation can be used. Because the value of all the innovations that we all do only come when we implement, and that is a Achilles heel. Really challenge in Denmark is to scale, because we in each hospital, each sector have the non-invented here attitude, and I mean it is a challenge. So the scaling is important. To get the general practitioners on board is really, really important.
Yeah, we see exactly the same in the hospitals as well. Each hospital need their own version of our system. They need their own business case of the system, their own pricing model of the system, which we also talked about that previously, that it's really challenging to scale something like that when that's how it's thought of. But also coming back to the budgets, I also really think that it's important to change how we look at prevention, because most COVID-19 products that have come out now from all these investments are preventive focused. Well, if we go back to where we were before COVID, then all of that will just be dropped on the floor, and that investment will be a waste of money.
How can we prevent that this is happening? Mette?
Well, it is difficult because, as I said, money is also is narrowing down. So there will be very hard prioritization in the forthcoming period, and there's a lot of things that have been waiting in line. So it is a challenge. Yeah, I can say. Due to the scale discussion, I think what had happened in the last maybe 2 years is that I think we have a much more mature discussion in the regions about that. So now it is actually acknowledged as a problem. And that's the first part of actually doing something. And we have made, and we call it an innovation board, but it's actually a scaling board, where we, 4 times a year, we have a pipeline of ideas coming in from the regions, saying what are your best projects that should be scaled to other regions. And of course, now it has been a little bit difficult with this situation to keep up the pipeline. But there is actually quite a long pipeline that we are pushing forward. So we're trying different ways around that issue.
Yeah, just to the point that and this is like a classic technology discussion, that on the one hand what you guys need to do and we need to do is really what is the relevance of technology in terms of the problems that the healthcare system is looking into, and decision makers within our healthcare system. You really have to make the point, why is technology relevant? Like when I started saying, oh, there's an epidemic, this has got nothing to do with digital tools. It's got everything to do with digital tools. So to make that point, to really, so that we put, what are the solutions that we have? How are they relevant in terms of the problems that are out there and that are acknowledged by decision makers? And then on the the other hand, also educating decision makers into understanding what is technology and what can technology do. Like what Helle said, it's not just about moving one task from the hospital into the home or from the hospital into the local municipality. It's about changing, transforming the caregiving itself and giving competences to people working with this in everyday situations and empowering both patients and everyday healthcare workers. So that, like, educating decision makers into what can be done with digital tools. That's the second important thing. So use your ears and use your mouth in the coming period. And I just think for us to have a discussion with you, this network-based interaction, I think it's really fruitful. And like always, I'll be, we've had a discussion here, and this is going to do something in my head. And thank you there. Yeah.
And we're looking forward to take it from discussion to action as well.
Exactly. That's my point always.
That's there. I'm going to go to Beth for the next question.
Oh, you'll hold. Okay, sorry. Yes, sorry. I just wanted to second. I come from a startup, and I wanted to second what everybody is saying about innovation and access and trying it out. The question we have, and I'm glad to have then the health minister and also the region here, is that are you looking at what countries like Germany with the digital law and the FDA with the pre-certification and NICE, that they're coming with standards? Because that's a little bit of what we're struggling with now. How do we then, what are the requirements, what are the standards, what level of evidence, what data security, what do we need to do here in Denmark to sell in Denmark so that we also come and meet the requirements or the standards that are being set? Is there thoughts now within the government and at the regional level to create something like what Germany or the United States or the UK has really established over the past years?
I'm not sure what you're looking for. What do you miss?
Okay. So either something like a health technology assessment, which is a guideline. It says this is how we evaluate new technologies or new solutions coming in. Or in Germany, for example, I mean, they basically came with a playbook. If you want to be reimbursed by the healthcare system, you need to have this level of data, you need to have this security, you need to have this, evidence and effect and everything else. So it basically helps people like us understand what are the expectations from your side that we will deliver as a product so that you are willing to either use us or pay for us.
There's a mic there.
Yeah. A very good question. And actually, I would say also that it's something that is really helpful for us, is that before we meet each other, you have met all these requirements, especially when we're talking about the scale part. So what I mentioned on the last slide, this council that are now located in the north, this is actually what they're doing. And we have been very inspired by NICE, and we have done analysis all over the world of who is doing things in a good way. We have looked at Norway, we have looked at Australia and Germany, and we will try to do something that, of course, is international equivalent, but also that is light, and that is really difficult. So right now, we're working in two paths. If you want to introduce something to the healthcare sector that is going to be scaled all over, we might have to do, I don't know, 3-5 assessments a year. It's quite heavy stuff you have to document. And then we would like to do a more light version like NICE have. Yeah. And the other thing, of course, is the CE. Yeah.
Yeah.
Yeah. So follow that.
I just have a comment on that. I hope that you're aware that the FDA will probably come up with labeling for sensor technology. And the good thing about that is that labeling is based on research, and I'm a researcher, I love that. So it's based on evidence. And I always say when I talk to lay people about e-health, it's like having a smartphone and you have your list of contacts. The list might be hundreds of people, But it's not the meaning that you have to call all of them every day. It doesn't make sense. And that's the same with, for example, patient-reported outcome. It's easy to send an electronic questionnaire to a patient, but why are you doing it? What is the purpose? Don't make the user tired by asking questions which is only for you use, but not for the patients. So I think labeling is actually very, very important within this field.
I also really hope that we're talking about guidelines here and not the public sector putting in regulation and innovation. Yeah.
Thank you. One last question. We have about 3 minutes, and it's a simple question that we can definitely answer during that time. How do you see the role of technology combating inequality in health? And how has that so far, how have so far the learnings from COVID-19 brought new perspectives to this? Anyone would like to start? Mette?
Yeah, I would say that it's something that we are still exploring if you saw the political agreement we just did before this summer, there will be an emphasis on inequality and digital inclusion in the coming year. We will look more into this field because we know that both sides, there are some that we are not seeing, that we are missing, but on the other hand, we are also reaching out to people that we didn't reach out to before. As I mentioned, within psychiatry, we see quite an interesting results from video consultation, virtual consultations within the field of young people, but also those with post-traumatic stress syndrome. So I think it's both-sided, and it's much more. It's something that we really have to look more into. Yeah, we have put a little bit of money in the strategy we have together with the state on this topic. So we will definitely explore it further.
And if I can just add to that I also think what is interesting here is that the COVID situation have put emphasis on inequality. I don't think we have solutions concrete yet, but at least now the conversation is stronger on how technology can help.
Yeah, and Henning's story about being a kidney patient is exactly about this, him being vulnerable and him being able to get much more patient empowerment, staying at home, deciding how does he want to spend his day. So I think there's definitely an inequality agenda attached to technology, and I think we're on the right track, using video, using patient-reported outcomes, etc.
I still believe there is also a trap to that. So that if we don't somehow have a safety net, that we really will not, then it will be unequal. There are things that we shouldn't miss out on because it will not be everyone jumping on it. But let's see.
And I also think we have to look at this in a way that the beauty of these technologies is that they might change resources. So we are able to replace resources from those able to care for themselves to those really needing the care. But, the healthcare system has to be brave and go away from this model with everyone has to have the same service. Those who need service, they are going to get the service. And eHealth can help us to replace resources to those who really need it.
Thank you very much.
Can you just ask them how many has downloaded the app?
Yes.
Which app?
Which app? The Smith stop?
The Smith stop.
Okay. Raise of hands, how many of us have downloaded the app?
And for those of you who haven't, please download it. And tell your families and your workplace and everybody to download it so we can help combat COVID-19. Thank you.
Yes. Thank you so much. It was. I think we could have spent the whole morning and the afternoon with this. It was heartwarming and heartfelt thank you from the hub and my colleagues as well. Thank you to everyone at home also. It's been great, and this is not a one-time event. We would like to have this as a continuous dialogue, to have it regular, but also to be able to have an open communication channel. So we will share, if it's okay with you, we will share the details of each other, so that you can continue these conversations also bilaterally when it's where it's necessary. We have some very small presents for you as well. They're not ice cream, which was a pretty good decision, I think. Looking forward to the next time, and thank you very much to everyone that joined online, and everyone that came here as well to see us. Until next time.
Thank you.
So, well, yes.
Thank you.